I'm Dr. Ian Lieberman. I'm an orthodontist at Smile Every Day. I get the question all the time, how long am I going to need to wear braces or Invisalign? Ultimately, every treatment is different. Really depends how far we have to move teeth. Sometimes you're having to do more movement than it might seem just looking at your smile. That's ultimately where coming in for a consultation where we can take, all the proper records, really get a look at what your needs are specifically, and we can have a more thorough plan customized for the beautiful smile we can create just for you. On average, most patients will have treatment for somewhere around 2, maybe up to 2.5 years, but oftentimes with modern technologies, we're even underneath that in a year to a year and a half. Realistically, the rule is anything hard or sticky, I've got to tell you to try and avoid during treatment, because you can push braces off of your teeth or kind of pull them off with any sticky foods. Foods like popcorn that aren't really hard or sticky that you might not think of off the top of your head can get stuck underneath the braces, and if it doesn't pop a bracket off, it can actually hurt your gums. There's a lot of things people don't think about, like ice, that people will chew on. That is obviously very hard as well. But there's also a lot of really good foods you can enjoy. Think of all the soft foods that you encounter throughout a day. Macaroni and cheese, mashed potatoes, fish. There's a lot of really good foods that are really healthy for you too. You can get a fully nutritious diet and still avoid any breakage during your treatment and get fantastic results. Another really common question I get is which is the best treatment that for me in particular, braces or Invisalign, sometimes even lingual braces on the inside. Ultimately, every situation is different. Every person has a different amount of tooth movement that they're going to need, and every appliance excels at different movements. So realistically, rotating some teeth might be faster, closing bites might be faster one way or the other. So most of the time you can get to the same place with any material that you're moving teeth with. At the end of the day, it's about getting the right force on the tooth one way or another, whether that's with plastic, metal, ceramic, gold. Really, you can get there either way. So, when you come in for a consultation, we can talk about where your teeth are specific for you and which might be faster. Ultimately, what goals you might have for your teeth. You might see certain movements happen faster, even if the treatment length will be about the same between the two. I get asked all the time how often appointments will be. Ultimately, there's more to life than moving teeth, and we get that. Realistically, we are trying to set as much in motion as we can each time we see you and minimize how many times you might have to come to the office. On average, in braces, we can set up appointments to be every 8 weeks, sometimes even a hair more. When we can set less in motion, sometimes in the middle of treatment or towards the end, we might have you coming in every 6 or every 4 weeks for certain appointments. In Invisalign, we can spread things out even further because everything's kind of set up with a digital plan that we make for your teeth. So sometimes I can see you just every 3 months, 4 times a year, just to make sure things are on track and moving the way they should and kind of guide things as we go. That's ultimately how you get to the end. Realistically, breakage is a part of orthodontic treatment. As much as we try and eliminate it from happening, the national average is that there could be at least 1 broken brace per patient during their treatment. So since it's very likely to happen at some point and we're working with very small objects in the mouth and things can be uncomfortable, it's good to have a plan. More often than not, using things like wax on your braces can create a smooth surface so nothing can be poking, at least until you can get to the office for us. You can always call us. We work 7 days a week, so we can bring you in and clip a wire, make sure that things are as comfortable as they can be for you until we can at least repair something. But more often than not, you can get right to us for a repair and keep your treatment moving as efficiently as possible. Ultimately, nothing we do in the mouth is comfortable, but we do our best to make sure that it's not going to be uncomfortable for you. That's the best way to get to an amazing result with a great experience along the way. Realistically, every situation is different and every person might need a different amount of time in treatment. We do base our treatments based on how long your treatment might take. Realistically, we do have options to make sure that it is affordable. Ultimately, different ways that we will make sure that you can achieve the smile and the results that you deserve.